Welcome to Family Medicine at Advocate Lutheran General Hospital. When inpatient, family medicine residents convene in our dedicated workspace, commonly called 6 South. It has ample space for multiple residents to have either desktop or laptop access with Dragon dictation abilities. The area has also become a space for residents to come spend time together outside of work hours. During your residency here, you will help serve on the Family Medicine Inpatient Service, which cares for our patients that we see in clinic and are admitted to the hospital. As an intern, you will work on the Adult General Medical floor for 4 blocks, and this tapers down as you progress in residency. Our inpatient census allows for a good balance between education and volume exposure, with patient caps in place per resident. Senior residents also get experience and feel comfortable in managing rapid responses. We provide a thorough inpatient experience, and graduates who are interested have gone on to careers in hospitalist medicine. After discharge, residents follow up on patients they cared for in the hospital with either outpatient or home visits. Residents are required to do 1 block of training in the medical ICU during their intern year. Lutheran General Hospital is home to medical, surgical, neurologic, pediatric, and neonatal intensive care units. The acuity of the patients you see here during your training will prepare you for a variety of cases you may see in the future, whatever your career path may be. While working on the medical ICU, a typical resident carries about 4 to 6 patients per day. This is an ideal opportunity to get experience with procedures such as central and arterial line placements, if it is of interest to you. Our pediatric inpatient training includes 2 months of working at the Children's Hospital General Medical floor. The Children's Hospital services the entire northwest suburban area, and patients are transferred in from a variety of local hospitals for top-of-the-line pediatric care. Because of this, you can expect to see pediatric patients with rare and unusual diseases. Throughout your residency, you will also care for newborn children in the hospital's nursery. This rewarding experience allows for great opportunities for continuity of care of both the babies you yourself deliver, as well as those that are assigned to you. As an intern, you will train on the labor and delivery floor for 2 blocks. During this time, you will function as an obstetric resident and manage low-risk laboring mothers throughout their stay. Advocate Lutheran General Hospital's labor department has about 37,000 deliveries annually, and residents have ample opportunity in mastering their obstetric techniques. Our program has a minimum requirement of 40 deliveries during your 2 blocks on the floor, but most residents go well past this with no issues. Residents that express interest can also participate in C-sections as interns. Seniors can also opt for an OB track as part of their training and do extra training later in residency if they so please. Your pediatric training will continue at the Yachman Pavilion, where a variety of outpatient visits occur. This facility houses outpatient offices for all pediatric subspecialties, which residents have the opportunity to rotate with. We are fortunate to have both the Inpatient Children's Hospital and Yachman Pavilion attached to Lutheran General Hospital, allowing our residents to not have to travel off-site for their premier pediatric training. Across the street from Lutheran General Hospital is Nesset Pavilion, where our outpatient clinic is located. It is easily accessible from the hospital by walking, a free hospital shuttle, or your personal car. As residents progress through their 3 years in the program, the curriculum increasingly emphasizes outpatient medicine, with more days in clinic making up their work week. Each resident is given their own separate workspace in a larger office, shared with co-residents to allow for camaraderie and support. Clinic rooms come with all standard equipment. Our patient population spans a wide socioeconomic range and includes a variety of payer mixes, including fee-for-service, PPO, HMO, and a significant percentage of Medicaid-insured patients. We are fortunate to serve a culturally diverse patient population, exemplified by the fact that 55 different languages are reported to be spoken at the local high school. Our outpatient training provides the opportunity to perform multiple procedures, some of which include suturing, skin biopsies, colposcopies, endometrial aspirations, IUD and Nexplanon insertions, joint injections, and fracture management. Our osteopathic pathway offers DO residents instruction and the opportunity to perform OMM on clinic patients as part of their curriculum. All resident patient encounters in the office are supervised by a panel of attendings that are present and available in the clinic. The Sports Medicine Fellowship at Lutheran General Hospital was founded more than 25 years ago. Located just one floor below the Family Medicine Clinic, the fellowship is closely tied to our residency. Their faculty are available in our clinic on a weekly basis and provide us with monthly lectures. Their facilities include a human performance laboratory, which includes a Woodway treadmill and Excalibur cycle ergometer, where we can perform cardiopulmonary exercise testing. In addition, you have access to a Sonocyte Export ultrasound machine for diagnostic and ultrasound-guided musculoskeletal injections. A unique component to our residency training is its association with the Adult Down Syndrome Center, or ADSC. The ADSC is run by our family medicine staff and is a world-renowned facility for premier outpatient and inpatient care of patients with Down syndrome or other etiologies of mental delay. We are fortunate to have the rewarding opportunity in assisting the ADSC in their care of their patient population. We look forward to having you become an integral part of our close-knit group.